Hi everyone, I am here today with Dr. Stephanie Strozuk, who I had the great fortune and privilege of crossing paths with. And I want to spend a little bit of time talking about her transformation journey, which I feel so incredibly inspired by and so certain is going to reverberate powerfully in the lives of so many patients that she is currently working with and has yet to heal. And I'm really blessed to have played any part in this. So I want to start, Stephanie, by sort of giving people a window into your journey, which is so much like mine, in that you really come from a place of hard work and dedication to a certain model of medicine that now you've begun to see the holes in. So tell us a bit about, sort of where you're coming from and maybe how our paths crossed.
Sure, absolutely. So, I have to say, as an adolescent medicine doctor, if you go all the way back and I think about how I was during my teen and young adult years, I actually, got through those years relatively well. Didn't really have many issues as far as like anxiety, depression, really any medical issues. So I think I was kind of lucky in comparison to a lot of the patients that I see currently. And, went through college, went through medical school, and did, relatively well, medically, psychologically. But I found it really wasn't until I began my internship, my residency, my fellowship, that things started to kind of fall apart a bit for me. I was extremely fatigued. I was getting very anxious. I was gaining weight, just really not feeling well at all. And, I kind of felt, well, I'm at the hospital at 6 a.m. and I am, going to sleep really late at night and doing 30-hour shifts a couple of times a week. I mean, didn't really have much control over this, and that I knew. Was really eating horribly because, especially when you're doing your training, I'm sure you remember, there's
Yes.
no time to go and, sit and have a nice lunch or have a nice meal. And it's kind of running to the gift shop and trying to grab, something over there, or running to the hospital cafeteria, which doesn't really have healthy food there either. So I was kind of in this cycle, knew I wasn't eating well, telling my patients to do one thing and I was doing the complete opposite, and was just really feeling miserable on multiple levels. So, really, what did I do? I wound up going to my primary care doctor and I said, listen, I'm not feeling well. I'm feeling really tired. I'm feeling anxious. I'm gaining weight. What do I do? What am I missing here? I kind of wanted to be the patient instead of being the doctor for once and have somebody, try to take care of me. And so basically, my primary care doctor ran some labs and said, well, you're not anemic, your thyroid's okay, you're a doctor and you're busy, and this is why you're feeling the way you do. And I said, okay, I guess there's not really much I can do about that at this point. And then as time went on, the answers started to become, well, now you're a doctor and you're a mother. And so you have that as well, and that's why you're tired, and that's why you're feeling anxious, and maybe going to see a psychiatrist might be something that can help you to help with your anxiety, at least with that piece. So me being the good patient that I was,
Right.
decided, okay, well, this is what's recommended to me, and maybe that's what I need to do to feel better, because I was just feeling so miserable. So I can say for the better part of 15 years, I had gone down that path, and was basically told by multiple doctors, whether it be my primary care doctor or my OBGYN or the psychiatrist, that my answer was lying at the bottom of a prescription pill bottle.
Right.
That's basically what I was told, and really wasn't told anything about nutrition, although in my mind I knew I wasn't doing the right thing. I wasn't, as I was taught, eating all my whole grains and eating a low-fat diet and taking meat out and doing all the things that I was telling my patients to do. And this is what I had learned. So, intuitively I knew that the diet was a piece. So I embarked on that, and every morning I made sure I had my whole grain cereals, and I was bringing my sandwich to work with me on my whole wheat bread, and making sure everything was low fat, and I was gaining more and more weight, and I was feeling more and more anxious, and I was feeling more and more fatigued, and just wasn't getting the answers that I wanted for myself. So it was actually in 2013 when I came to find you, Dr. Brogan, and I found you through a friend. And I just kind of, looked you up and looked at your website, and I found it very interesting that you were a women's health holistic psychiatrist. I thought to myself, well, this is something I've never tried before. Somebody who does women's health and psychiatry, I think this will be a good match. So went to my consultation back in 2013, and I have to say, from that point on, my life changed in the best way possible. Because, when I came to see Dr. Brogan, we sat and we spoke for an hour and a half, which I had never done with a doctor. And we went all the way back to when I was born, went through all of my medical history up until the point that I was sitting there, and really picked out and saw the things that had been happening over the years that, I didn't think were such a big deal, but wound up being an issue. Like, for example, dealing with acne from when I was a teenager up till I was 40 years old, and being on multiple rounds of oral antibiotics and topical antibiotics and Accutane and all of these things, and never truly getting better. It's just one example of the things that we were kind of uncovering. And so when I left the visit with different kinds of prescriptions than I had gotten in the past. So one of the prescriptions was a complete dietary change. Everything that I had been doing, off the table. We were really going towards the more ancestral diet, and I was completely on board. Because again, I was going to be that good patient, and I was going to do what I was told to do. So I went ahead and I did that. I was given prescription for some blood work that looked a lot deeper than anybody had ever looked before. My salivary cortisol testing was done. I was given a prescription for yoga movement and a prescription for meditation. These are things I never embarked on before. And I have to say, I dove in head first. And within days, I would have to say, changing the diet, doing the meditation, and then eventually coming to yoga, something shifted right away. There was a fog that was lifted from me. It was really astounding. I had never experienced anything like that before. We eventually got my lab results, saw some issues there. I was, depleted of micronutrients. I had adrenal fatigue. I was estrogen dominant. I was actually iron deficient, even though my hemoglobin looked normal on other labs. So there were so many pieces that were coming together, and it was becoming very, very clear that my gut health was a mess as well, from probably all, the stress under for years with my training and what I was eating, what I was putting in my body, what I was putting on my body, the antibiotic use. So like I said, I dove headfirst in and did all of the things that were asked of me at the time, and I came back, I think, to see you, Dr. Brogan, in 4 to 6 weeks, and I felt like a different person. I really did. I mean, I felt vibrant. My skin was clear. I had lost 15 pounds without counting a calorie, because we're always told it's calories in, calories out. Nothing to do with that. It was a huge, huge shift, and have been basically living my life this way ever since.
Right.
And it's just been amazing.
So you're such a good example of how little support people actually need when they're ready, right? It's like I just sort of,
Yes.
just like give you a little, whisper or something, and you ran with it, and had this transformation that endures to this day. And not everyone is like that. I mean, you describe yourself as being, constructed as somebody who likes to adhere to rules and expectations. Yeah. Mm-hmm. And in so many ways, we're a great fit, right? When I often, tend to rule with an iron fist, I guess, in the beginning, in service of, sort of initiating people to their own self-authority. But what if someone is not constructed the way you are, and they find the number of commitments, the number of changes that you made really overwhelming? How do you sort of hold out a hand to that person? How do you sort of let them know that there might be an early win or an early sign that they're on the right path, and that all of this effort and commitment is worth it? I mean, in my description, you've certainly done more than just go from symptoms to no symptoms or meds to no meds, that there's been something else at play here. So, how can you sort of light the path a bit?
Right. I mean, like I said, it is difficult for many people, and you can imagine working with teenagers how difficult it is. Because when I tell them, listen,
yes,
I want you to do this type of diet, and it's really eliminating this, and this, and their faces just completely drop. What am I going to eat? How am I going to live? How am I going to go out with my friends? What am I going to do? What am I going to have for my breakfast? This is what I have every day, and panic starts to set in. And it's funny, many times I actually use my daughter as an example, because my daughter's 11 years old, and when she was 9, she was having migraines. And it's funny because I used to actually run a headache clinic at one of the hospitals that I was working at, so I kind of knew what to do. But when it really came down to it, I was actually practicing, looking through a different lens. And with my daughter, I found out that her 2 major issues that were driving her migraines were eating gluten and dairy. And we removed those things, and she does not have migraines anymore. And for my 17-year-old that comes in and says, no, there's no way that I can do this, I will use my daughter as an example and say, listen, when she was 9, we did this. And now she's 11, and she'll tell me, you know what, Mom, it's not worth it for me to eat that because I feel sick after. So I kind of put a challenge on them and say, if an 11-year-old can do this, I think it's something that you can really do. And I try to meet them where they are and tell them, I'm going to give you this information, and I don't expect that tomorrow you're going to implement it. But I really, truly feel that the things that I'm recommending to you can make a huge shift in how you're feeling. And when you're ready to start doing it, you're ready. And I'm going to be here to support you with any questions that you have, and to support you along the way to get you to where you need to be. And that's really the approach that I try to use with my patients.
Absolutely. So now you have really internalized the fact that you can't change someone with information, right? You can provide information, but that the change actually happens from an experiential shift, right?
Yes.
And so now you're sort of paying that forward, in your own practice, and even had the experience of healing your own daughter. What's more powerful than that? And it's incredible. So, the experiential shift that you had, like the one that I had, in the experience of my own Hashimoto's, it's a bodily knowing that there was something we didn't learn in our training, right?
Yes.
And what comes with that bodily knowing, that there's a greater truth out there than what we were exposed to in our training, is that you begin to question a lot of other things, right? You begin to say, well, I also relied on this source for this, and this piece of information, so perhaps I need to look elsewhere, or look within myself, for a different concept of how to proceed. So tell us a bit about sort of so you have this experience of dramatic healing within basically a month. How did that unfold? Was there any, or does there remain, any difficulty integrating sort of old life, new life? As a professional, sort of, do you feel like you know exactly what to do, or you're trying to synthesize, because that kind of a transformation, especially when it's this rapid, can come with unexpected challenges.
Right. I mean, it's always a learning curve. There's always things that you can learn and incorporate, and of course there's going to be hiccups along the way, but in general, I feel, for me, really trying to adhere to a whole foods diet, it is what keeps me feeling well.
Yes.
And I noticed that, absolutely, for me, gluten-free, I need to be. I know my body, when I get a little bit of gluten in it, I just do not feel well. So that is something that's just been off the table. And, like you've always said, being an Italian girl, that might be a little bit difficult, but we've managed, and I don't really miss it at all. with some other foods like grains, I do have some grains here and there, but for the most part, I see how my body feels. And if I start to feel like, well, I think I might be having a little bit too much of that white rice, I back off. So, for different people, it's going to be a bit different. But for me, I definitely find that the dietary piece was the major shift for me. Because not only was it healing my gut, it was stabilizing my blood sugar. It wasn't putting me on the roller coaster during the entire day. So that's the piece that I think that was most important for me. And again, with teens, that can be difficult. So I try to, work with them and hold their hands along the way and try to come up with concrete options of what they can do to incorporate this new way of living. It's not a diet. And I try to explain, just as you got used to drinking that diet soda and, eating the way you're eating in this way, you'll become accustomed to this being your new normal. It takes time, and like I said, they don't go out the next day and incorporate it, but it can be done, and the way you will feel will be unlike anything you're feeling now. And not just, from the psychiatric standpoint. Like for me, it's, patients that are coming in with polycystic ovarian syndrome, or coming in with chronic migraine, or chronic abdominal pain, or acne, and it's all kind of the same thing at the end of the day, like really getting to the bottom, the root of what is going on, rather than, practicing, unfortunately, how I was practicing in the past with very short visits and putting a Band-Aid on things and trying to treat symptoms instead of getting to the bottom of what's going on. And it's funny, sometimes when patients come in with irregular menstrual periods, they'll look at me quizzically and say, why are you asking me about what I'm eating? And why are you asking me about how my stomach is feeling? And why are you asking me? And I said, it'll make sense at the end of the visit why we're looking at everything.
I love that.
Yeah.
Yeah. So, you've alluded to your practice. So I should mention, that Stephanie has one of the very unique qualifications of being specialized in the treatment of not only pediatric patients, but specifically adolescent patients. I mean, what more important time is there to help facilitate, sort of a healthy initiation to adulthood? I mean, we don't have elders anymore. We don't have tribe anymore. We barely have community. And so working with healers such as yourself is, potentially a life-altering experience for these patients. And we were talking earlier about the fact that you may be one of the only people in the country who is now taking a holistic approach, largely, right, thanks to your own experience of what's possible. So I wonder, my perspective on medications, obviously specifically psychiatric medications, but my concerns that when we use medications the way we do reflexively from a fear-based place, that we are interfering with the potential for a deeper investigation into imbalance, whether it's physical, dietary, environmental, psychospiritual. So I wonder if, because we certainly both were trained in a modality that really only offered us medication as an intervention, as a legitimate intervention for our patients. So I wonder how that is evolving for you, what your perspectives have come to on that.
I can tell you actually that my prescription pad is collecting a lot of dust because I'm really prescribing anything really at this point. Besides,
I love that.
Really, changing your diet, moving, meditation. That's most of what I am prescribing, and then prescribing nutraceuticals as needed to correct whatever imbalances that we are uncovering. I have to say that most of the patients that are coming to see me, at least at this point, are patients that have been down the conventional path, and they're finding that it's not working. So whether it be the 25 or 26-year-old that's coming and they're realizing it's not working, or it's the parent of the 12-year-old that's saying, this is not working for my child, what else can I do? I'm kind of like one of the last steps. And I'm hoping at some point to actually be the first step for my patients so that they don't have to go down this rabbit hole of, one drug begetting another drug, and really from the get-go, healing instead of suppressing the symptoms. That's my ultimate goal.
Love it. Love it. I mean, my smile couldn't be bigger. It's like taking over my face. No, I'm so inspired and so thrilled, and I just honestly, couldn't feel that it's it's auspicious, how important it feels to me to have played this, again, small part in your process to sort of tip you off in the direction that you obviously needed to go, and that you needed to go to impact the lives of so many other people at this very vulnerable window.
Right.
So I'm going to be cheerleading from the sidelines, for you from here till forever, because I just think what you're doing is so critical, it's so important, and it's so needed. And you're a perfect example of how essential sometimes mistakes are, sometimes going off the path, or going down one route to get to another totally unanticipated one. And really the archetype of the wounded healer, how you needed to have your own healing journey in order to really bring this wisdom to the patients that you are destined to heal. So I thank you so much, for sharing this, first of all, for having the courage to sort of come out of the closet on your own experience, yes. Which as doctors we're sort of taught never to do.
Right.
I know all about it. But it's an essential part of the message that only you are here to share. So I'm so honored. Thank you so much for your time and
absolutely,
for spreading the good word.
So pleased that we have crossed paths, and you lit the way for me. I mean, that is exactly what happened. You lit the way, and I'm just hoping to be able to pay that forward and do that for patients that I come across.
That's beautiful.
It's a great feeling when you really are truly helping to heal somebody.
That's beautiful. Thank you so much.
Thank you.